Guys, so here let's talk about the basics of neuroanatomy part 2. Okay, so in the second part let's talk about the cranial nerves. So just remember the cranial nerves with the number 4. All right, so the first of all, know that there are 3 parts where the cranial nerve nuclei reside in: midbrain, pons and medulla. And as we can see in this image, pons is the central one, right? So 4 lie above the pons, 4 lie in the pons and 4 lie below the pons. Okay, so the first 4, 1 2 3 4, the first 2 cranial nerves do not have nuclei. Okay, so therefore the 3 and the 4th, the 3rd and the 4th ones reside in the midbrain. Okay, so 3 and 4 in the midbrain. I think I did a mistake here. It is pons and this is medulla oblongata. All right, so the next 4, the next 4, 1 2 3 4 are done here. 1 2 don't have cranial nerve nuclei. 3 4 is done. So 5 6 7 8 in the pons. 5 6 7 and 8, and the last 4, 9 10 11 12 in the medulla. All right, so 4 above pons, 4 in pons, 4 in the medulla. The next thing that we have to remember is the medial ones. So the medial cranial nerves are what reside medially as compared to the other cranial nerves. All right, so those you can just divide with 12. Okay, 12 by 1 is 12, 12 by 2 is 6, 12 by 3 is 4, 12 by 4 is 3. So just remember these: 12, 6, 4 and 3. So the factors of 12 except 1 and 2 are medial cranial nerves. So as you can see in this image, 3 is this one and 4 is this one. These are medial, and then 6 is again here. This is also medial, and the last one, that is the 12th one, is here again. These are the parts, right? So this is also medial. So these 4 are the 4 medial cranial nerves. So the next thing we have to know are the names of these cranial nerves. So I'll give some small mnemonics to remember. OL, so L for 1. Optic, just remember tick with 2. Okay, oculomotor, OC, right? So C is nothing but the 3rd alphabet. Trochlear, TRO, just remember it as FRO or 4. Okay, trigeminal, tri is rhyming with 5. Make sure that you know that trigeminal is not the 3rd cranial nerve. It is rhyming with 5. Okay, abducens, I think most of you know that there is a cricketer named ABD Villiers who is known for his 6s, right, in the cricket team. So therefore ABD for 6, abducens nerve for 6. Facial, so I think most Indians would know that MS Dhoni, even the other country guys obviously, the cricket fans again. So MS Dhoni is the face of the Indian cricket team men's, right? Therefore, and you know that MS Dhoni wears a jersey with the name 7 on it, right? Therefore, Dhoni, who is the face of the Indian cricket team men, wears the number 7. Therefore, facial nerve 7. This is a bad mnemonic, but just bear with me. Ear is nothing but eat. Just replace R with T and then jumble these. EAT becomes ATE. Therefore, 8. Glossopharyngeal, G starts the term starts with G, which looks like an N, which looks like a 9. Vagus, just make this V double V. Just draw another V here. So this becomes 10. Alright. Accessory, as you can see here, there are 2 C's, there are 2 S's, and in the number 11 we have 2 1s. Therefore, SS, SS, CC, SS and 11, 1. Hypoglossal, sul is, last. SAL is nothing but LAS. Therefore, the last cranial nerve, that is the 12th cranial nerve. Alright. So now let's talk about the functions of these cranial nerves. As the name says, olfactory is nothing but smell. Okay, and as this again the name says, optic means sight. So sight, make sure you know that sight is not the same as eye movements. Okay, so eye movements is innervated by 3 different nerves, that is 3, 4 and 6. 3, 4 and 6. These are the 3 cranial nerves that innervate the movements of the eye. So let's talk about those now. So let's come from the back. So 6, the cranial nerve 6, as we thought it would be, we can remember it as with ABD Villiers. So when he hits a 6, the ball leaves the stadium, right? So it left the stadium. Therefore, left, that is lateral rectus. Okay, the ball is going away. Therefore, this is going, the eyeball is moving away, right? Therefore, lateral rectus. Therefore, the sixth cranial nerve innervates the lateral rectus muscle. The fourth cranial nerve, that is the trochlear nerve. Just remember TOSO. Okay, so the trochlear nerve TO innervates the SO, that is the superior oblique muscle. Okay, and the rest of the muscles are innervated by the third cranial nerve. Therefore, like we discussed, LR is given by the sixth cranial nerve, SO is given by the fourth cranial nerve, and the rest are given by the third cranial nerve. So SO has an O, right? IO has an O. So IO is inferior oblique, SO is superior oblique. So with O you can remember that it is opposite. Okay, so opposite, that's why inferior oblique muscle makes the eye look upwards instead of downwards, and superior oblique muscle makes the eye look downwards, not upwards. Okay, because it is O, it is working oppositely, whereas superior rectus doesn't have an O, right? So superior rectus and inferior rectus, which are supplied by the third cranial nerves, they look upwards, they make the eye look upwards and downwards respectively. And again, lateral rectus makes the eye look outwards, and medial rectus, given by the third cranial nerve, makes the eye look medially. Okay. Therefore, the main functions of oculomotor are with SR, superior rectus, inferior rectus, medial rectus, and inferior oblique. Pupillary constriction by innervating the muscle sphincter papillae, and by innervating the muscle levator palpebrae, it makes the eye open. Okay. And trochlear nerve TO for SO, therefore SO, right? And trigeminal nerve, as the name says, it has three parts. Okay, the three parts are ophthalmic, maxillary, and mandibular. Okay, so this is your face. So these are your eyes, and this is the nose, and this is the mouth or lips. So here, this is the ophthalmic part. Since these are the maxillae, this is the maxillary part, and this is the mandible, right? So this is the mandibular part. Okay. So the main thing we have to remember here is it innervates the face. Okay, sensation, whereas facial is the movement nerve. So sensation is given by the trigeminal nerve, and movement is given by the facial nerve. Similarly, sensation to the anterior two-third tongue is also given by the trigeminal nerve, whereas taste from the anterior two-third is given by the facial nerve. Alright, so these are the main ones here. Facial nerve also innervates the glands, most of the glands except parotid. Okay, so I'll tell you why later on. So the other muscles, the other glands like lacrimal gland, submandibular gland, and sublingual gland are supplied by the facial nerve. It also innervates the eyelid closure using the muscle orbicularis oculi, and it also innervates the muscle stapedius, which is present in the ear. Vestibulocochlear, in the name itself, it is ear, right? So inner ear. So inner ear's main functions are hearing and balance. Glossopharyngeal. So the gloss means tongue, right? So this is the tongue, and right here from your mouth, your pharynx is going away, right? This is the oropharynx. This is probably your nasopharynx, and this is the pharynx. So the parotid gland resides right here, right in the middle of the tongue and the oropharynx. Therefore, the glossopharyngeal nerve supplies to the parotid gland. So the rest of the glands, that is the lacrimal gland, submandibular, and sublingual, are supplied by the facial. Therefore, this supplies to the parotid gland. Alright, and it also takes care of the carotid body and the sinus chemo and baroreceptors basically. Alright, and taste and sensation from the posterior one-third. So anterior two-third sensation was given by the trigeminal nerve, and movement was by the facial nerve, right? So here the posterior one-third, both sensation plus movement, is innervated by the glossopharyngeal nerve or the ninth cranial nerve. Vagus, V, that is the 10th cranial nerve, is the main nerve in the parasympathetic nervous system. Okay, parasympathetic nervous system. So it also innervates the uvula or the soft palate. Okay, and it also maintains the aortic arch chemo and baroreceptors along with the glossopharyngeal nerve. Accessory nerve is the neck nerve. Okay, it innervates the neck muscles. So the neck muscles are nothing but SCM and trapezius. So SCM is nothing but sternocleidomastoid and trapezius is trapezius. Therefore, these two muscles innervate your neck movements. Therefore, head turning, which use your neck, which you do using your neck, and shoulder shrugging, again with your neck, are done by accessory nerve. Hypoglossal nerve, again gloss means tongue. Therefore, tongue movements is innervated with the 12th nerve.